Okay, everybody. I'm going to get started because I don't want to take any time away from our keynote speaker. So officially, I am going to call this meeting to order. All right. Just for the record, I do not have any disclosures. If anybody has any, please let me know. And I want to go first to our awards. We have several awards that I want to recognize and present today. So our abstract winners, for anybody who went to our abstract session, we had several really good abstract presentations, but we did have to choose from them the top two. Before I present those, I want to thank dearly the ASMBS Foundation for providing those awards to the recipients. Our abstracts, just FYI, are evaluated on several things, including study question and results, the significance of the study question, review of the literature, research methodology, and applicability of results. So without further ado, I would like to take this opportunity to congratulate the second place winner, Dr. Bill Goresh, for his presentation on bariatric nursing practice analysis. Please give him a round of applause.
I just wanted to thank everyone for this award, but not for me. This was a group. This is a work of a committee of about 12 people or so, plus all of the 642 nurses who actually filled out the questionnaire. So I accept this for them. So thank you so much.
All right, and our first place winner, unfortunately she's unable to attend, Molly Orcutt, for the presentation on associations between childhood trauma and psychopathology in female bariatric surgery candidates. Is Dr. Mitchell here perchance? He gave the presentation for her, and if not, we will get this to her. So congratulations to Molly. I do want to congratulate and thank all who submitted their abstracts, posters, and presentations. Integrated Health has really benefited from all abstracts that have been submitted and presented, whether it be yesterday, today, or the future, and whether it be poster or presentation form. So please keep the research coming and submit your abstracts. I have a bunch of Integrated Health Awards. We formed some new awards this year, but I do want to first recognize and congratulate again Dr. Dale Bond, who received Circle of Excellence Award. He received that yesterday at the ASMBS Foundation Luncheon. And congratulations also to Nina Crowley, who received hers in Excellence in Nutrition. So we can give them oh, and I also want to congratulate Alice Jackson, who received the Certified Bariatric Nurse Award last night. So congratulations to them. The Distinguished Advanced Practice Award is a newly created award given to a deserving advanced practice provider practicing in the field of metabolic and bariatric surgery who has made an extraordinary effort to promote and further the practice of advanced healthcare providers in the specialty of metabolic and bariatric surgery beyond the role in the multidisciplinary team or program. This year's recipient is a nurse practitioner who has been in the field for over 20 years and has worked closely with Dr. Schauer in refining the laparoscopic approach as well as in the training of other practitioners and surgeons from all over the world. Over his distinguished career, Bill Goresh has continued in his clinical efforts as a recognized leader in the management of banned patients as well as difficult bariatric surgery patients. In addition, Bill now has a strong research focus leading the clinical site at the University of Pittsburgh for the longitudinal assessment of bariatric surgery study and as co-investigator for the Alliance of Randomized Trials for Metabolic versus Medic Treatment Trial for Diabetes Treatment, and the mechanism study addressing the hypothesis of intestinal adaptation as a mechanism of diabetes improvement post-gastric bypass. Most recently, Dr. Goresh has successfully defended his PhD dissertation, published more than 30 manuscripts, 25 abstracts and poster presentations, and has been invited speaker more than 50 times. Bill also demonstrates a passion for the professional development of others and expertly precepts and mentors a wide range of students, nurses, residents, and fellows. Bill has held many leadership roles within the ASMBS through his long and distinguished career, including President of Integrated Health Science Section and Chair of the Certified Bariatric Nurse Committee. Bill is simply a force in the field whose contributions are very deserving of this distinguished award. Please help me congratulate Bill Goresh as the recipient of the Distinguished Advanced Practice Provider Award.
Basically, I just want to say thank you so much to the Integrated Health Executive Council for selecting me for this award. I'm truly, truly honored. I've received some honors in my past, but this is really an important one. I'd also like to thank them for actually developing this award for advanced practice providers, alias nurse practitioners, PAs, and clinical nurse specialists. That was a big step, I think. I've been extremely fortunate in my career to have been given many opportunities. I've been able to, as Karen had said, those are the words of my boss, so I'm kind of really taken back she wrote that. But I've been able to be a clinician, educator, administrator, and researcher. But basically, it's only through the support of a lot of people that I've been able to, have the strength to do this. Many people have stood by me and held me up and at times pushed me along the way. And I just want to take a real few minutes just to thank a few of them. First, I'd like to thank my wife and my family that's where it all starts. But I'd like to thank Phil Schauer for giving me the opportunity to develop the advanced practice role in clinical bariatric surgery. I'd like to also thank Anita Kirkless, who's basically gave me the opportunity to take that role into research and to become a researcher. It was her mentorship that was very critical to me. And also I'd like to thank the ASMBS, the Integrated Health membership and leadership, as well as the surgeon membership and leadership, for giving me, presenting challenges for me and giving me many opportunities and opening up the doors to allow me to work on those. And lastly, I'd like to thank my bariatric surgery patients. I'm sure all the advanced practice providers understand. I'm sure that many of them hadn't a clue as to what the hell I was. What is an advanced practice provider? What is a nurse practitioner, for that matter, yet? But they allowed me basically to let me help them help themselves, as well as to come along in their journey. So I just thank them, and I'd like to thank all you as well. Thank you.
This is from her. This is from her. Okay. The Distinguished Behavioral Health Provider Award is another newly created award given to a behavioral health provider practicing in the field of metabolic and bariatric surgery who deserves recognition for all they do for patients, families, the community, and the profession. This year, our recipient is a psychologist who's been classified as ranking in the top of behavioral health providers when considering provision of outstanding, empirically informed clinical care, commitment to the advancement of the field, and dedication to the mission of ASMBS. Dr. Stephanie Sogg has served as a member, co-chair, and now chair of the Integrated Health Clinical Issues and Guidelines Committee, as well as a member at large on the Executive Council of Integrated Health, and liaison for developing the joint TOS ASMBS Obesity Week 2017 Symposia. She is eager to mentor early career behavioral health professionals and is tremendously generous with her time. She has spearheaded efforts to explore important issues to behavioral health providers, such as benefits and pitfalls of conducting telehealth pre-surgical behavioral health evaluations. Stephanie is a strong advocate for educating the public about behavioral health factors associated with obesity and weight loss surgery, evidenced by her regular practice of writing letters to editors of major publications regarding articles printed about these topics. Related, she has given numerous interviews to press reporters about obesity, alcohol issues after weight loss surgery, behavioral health and weight loss surgery, as well as other topics. Please help me congratulate Stephanie Sogg as the recipient of the Distinguished Behavioral Health Provider Award. Unfortunately, she is busy with her symposium, so Dr. Sogg is unable to attend this presentation. As I said, she is educating, so I will accept this on her behalf. And last but not least, the Committee of the Year. The Integrated Health Executive Council and the American Society for Metabolic and Bariatric Surgery recognizes the Integrated Health Committees dedicate many hours from their personal and professional commitments to provide the necessary planning and execution of the vision and goals of the Society in the Integrated Health Science section. The Committee of the Year award is given to a deserving committee who has demonstrated commitment to the Society's missions, goals, and objectives, and has assisted to further the Integrated Health Science section. As you know, the Integrated Health Science section is composed of 7 committees: Certified Bariatric Nurse, Clinical Issues and Guidelines, Communications, Membership, Multidisciplinary Care, Professional Education and Program, and Support Group Committees. There's a lot of work being done by each committee, and the decision was not easy. This year, the recipient of the Integrated Health Committee of the Year is given to the Clinical Issues and Guidelines Committee, which is co-chaired by Stephanie Sogg and Katie Chapman. Also extremely instrumental, especially with the toolkit, is Allison Grubsky. Without her leadership, the toolkit might still be sitting on base camp. Allison has spearheaded the organization and submission of documents for the approval process. As you know, the toolkit has gone live, and if you don't know, please check our ASMBS website, and it continues to be a work in progress with new documents rotating through the approval process. Please continue to check back frequently as the committee adds additional items to the toolkit. Also in progress are several new projects, including nutrition guidelines, macronutrients, nutrition guidelines pregnancy, and revision of the adjustable gastric band guidelines. The committee is completing review and revisions to the sensitivity training recommendations. Please join me in congratulating all the committees for their hard work, but to the Clinical Issues and Guidelines Committee for being recognized as the IH Committee of the Year. I believe this award is going to be accepted by, oh, Katie, you have a different hairstyle. Come on up, please. Katie Chapman, who is co-chair with Stephanie, is going to accept this award.
I actually just want to say thank you to all of the IH Clinical Guidelines, Issues and Guidelines Committee members. We could not do this work without you, and I'm extremely happy to be able to accept this award on their behalf. So thank you.
Okay. So I want to thank everybody who took the opportunity to vote in our recent election. We just had a member-at-large position that was open for both advanced practice providers and for behavioral health providers. And I want to congratulate Nate San, if you don't mind standing up and giving a little wave. And Stephanie Sogg, who is not here. It looks like the Stephanie Sogg hour. She's taken over here. But congratulations to you both, well-deserved, and glad to have you still on the committee. I also want to give a very special thanks to, again, Nate San and to Maureen Quigley, if you don't mind both standing. And thank you both very, very much for your extended year of service to your committees, the Integrated Health Communication Committee and our Professional Education and Program Committee. So thank you. Your extra year of service is well appreciated. For anybody who does not know, tonight we do have our state chapter rally. It's from 7:45 to 7:30 tonight. We might have a little change in the agenda. I'm not sure how everything is going to pan out. It's anticipated to have the governor from Maine, but I'm told there may be a little bit of a change. But we're still having the rally. We need Integrated Health to become involved and participate and show your support. So please come to the state chapter rally event tonight. Surveys. I just want to say a quick word on surveys. I know you get a lot of emails, a lot of spam. Some of you have firewall blocks, but we do surveys not because we feel like filling out surveys to send out, but because it gives us very valuable information. We had a membership survey and we presented that at a webinar, but we also plan to share that information through maybe an article on Bariatric Times, a compensation survey that went out. We had a fairly poor response on that. That is available in our lounge on computer, so if you get a chance to participate in that, we'd appreciate it. We really need this information and need your help with it, so it's important, so I appreciate any help you can offer with that. Just a quick recap of what has gone on in this past year. Bill, again, congratulations, 10-year anniversary. Jesse Moore, congratulations. This certified bariatric nurse was an awesome undertaking, and that was quite some time ago, and now you're realizing all that you've done, and we're realizing it too. They, as an FYI, are developing a new platform or looking into new platforms for certification renewals, as well as becoming accredited as a certifying body. We've had webinars. If you haven't participated, we're looking into offering more webinars next year with different topics. Please let us know what those topics of interest may be for you. Some of them have been credit-based, and we've also offered a town hall one. Obesity Week and ASMBS Weekend is provided to you by our Professional Education Committee. They work very hard all year long trying to put this agenda and outline together and try to target all the disciplines, not just one or two. So hopefully it's appealing to all of you. Please let us know what your thoughts and opinions and topics may be. We really look at your evaluations to help plan the next event, so please participate in that. Our toolkit, as I mentioned, is uploaded onto our website. It's for members only, and there is more to come. Let us know what you're looking for. We had some feedback already looking for job descriptions, and those are going through the approval process and will probably be uploaded in the very near future. Our support group committee has been very busy with pre-conference course and symposium this obesity week, and they're also doing some looking at criteria for support group leaders And they're doing other research as well. I don't mean to minimize, but there's a lot of work they're doing. Our membership committee is reviewing comments on from the recent survey and answering to those comments, and they're making revisions to the application to make it a fairly easier process. Social media, we have a Facebook presence. It's through the surgeon side, but please join it. It is for integrated health as well. We also have a Twitter presence that Pam Davis is involved with. And we also have some other projects that we're still completing and should be done in the near future, in the early next year, including sensitivity recommendations and our multidisciplinary care white paper. The year ahead, we still have a lot of work to do. It's never done. We need to advocate, we need to educate, communicate, and collaborate. We need your help. We need you to become involved. If you're not on a committee, please join a committee. We're going to have a checkbox for you and link for you on the renewal for your membership to get you to join a committee. So please consider it, because we do need your help. We do, as I said, need to advocate. Pre-existing conditions continues to be a sore spot with the healthcare in the limelight right now as it is. We need to be sure we advocate for the disease of obesity, for the treatment of obesity, and for the patient affected by obesity. We had a group yesterday go to the Hill to rally for and explain and educate to the legislators who are at this level, but we also need it at the local level as well. So please become involved. We need to educate. We really need to get that information out. You probably saw from the abstract committee that the abstract presentations, that there's still a lot of work to be done to educate primary care providers, specialists, other organizations, politicians, educators. We need to educate communities and patients about, again, obesity, obesity treatment, metabolic and bariatric surgery, follow-up, complications, and the list goes on. We hope to provide more educations in the form of webinars, articles, and create some library on our website, so stay tuned. We need to communicate. Social media is a great resource. Again, Facebook and Twitter. And there's probably going to be others down the line. I'm told Facebook is old news now, like my kids don't use it, and I think it's for the older folks, which I thought I was pretty good at using. But Twitter seems to be the new wave. Website, we are very busy with communication on the website. We have a dedicated integrated health section, and we're always exploring other opportunities to provide communication to our membership. We need to collaborate, not just within our discipline and our committees, but also with the surgeons. And we need to collaborate with other organizations like TOS, OMA, and other similar organizations with similar goals. And remember, I think I started this last year, and I will continue it until I'm done. There is no I in team. So please participate, join a committee, share any information, comments, or suggestions you may have, and share it to this IH-president@asmbs.org.